Hey, what's going on there, YouTube? It's Jay here again with another episode of Coping with My Cancer. So today I have just got back in from speaking with the surgeon, Dr. Lawless from Jefferson University Hospital. And today what we talked about was the pathology reports. For those of you who don't know, after surgery they take the tumor out, they send it off for testing to make sure of what kind of cancer it is. Basically, they look at it. They want to make sure that what kind of grade it is, and I'll go over a lot of these. I have the results right here, and I want to go over them with you. But in a nutshell, just to not keep you guys around forever if you don't want to be, the news was overwhelmingly good. Overwhelmingly good, really. About as good as it can get while still having cancer. We pretty much knew already. I mean, it wasn't a 100% done deal, but the way everybody was reacting and, especially after it was removed and the surgeon looked at it, we were pretty much had our heads wrapped around the fact that it was. And it was cancer, and it was going to be cancer, and there are going to be certain things that were going to change in my life, and that, if you've watched these videos at all, you know that wasn't really my problem. The thing I was most worried about was whether it was going to be some kind of a crazy variant or something like that. But I can now safely say that pretty much everything on this report here, this is what the urology report looks like. There's like kind of a summary here, and then there's some more stuff here, so we'll go through it here. This is final diagnosis: left kidney, left robotic nephrectomy, renal cell carcinoma, clear cell type, 2.8 centimeters, organ confined. Vascular and ureteral, the ureter, which is the ureter is the thing that goes from the kidney down to the bladder. For some reason I can't say that word. Vascular and ureteral resection margins are free of tumor. See microscopic description. So basically what this is saying is that I had a 2.8 centimeter mass, which is actually smaller than I thought it was going to be. 2.8 centimeter mass confined to the kidney, clear cell renal cell carcinoma, which is pretty much the garden variety version that 85% of renal cancers are. So they're obviously pretty used to dealing with this type of cancer. This picture that you're looking at right here is a picture, I just found this online. This is the clear cell renal cell carcinoma. They didn't give me any pictures of my specific tumor, but this is basically what it looks like under a microscope. And sorry about this one, but this picture is a picture of a kidney that basically has a tumor from clear cell renal cell carcinoma. So just in case you were wondering about that. Some of the microscopic description, which is when they go in here and they really break it up into specimen laterality, left, obviously it was the left kidney. Tumor site, upper pole. Microscopic extent of tumor. Tumor limited to kidney. Histologic type, clear cell renal cell carcinoma. Sarcomatoid features. This is a big one because sometimes cancer will take on a sarcoma type of look under a microscope. That's usually not a good thing. So sarcomas are known as being a little bit more aggressive than other types of cancer. So sarcomatoid features, it says not identified. So that's a good thing. Histologic grade, Furman nuclear grade G2. Nuclei slightly evident. Nuclei slightly irregular, approximately 15 microns. Nucleoli evident. I gotta look that up, but that's pretty. I think that's fairly low, but I mean everything else is low. Tumor size, greatest dimension, 2.8 centimeters. Microscopic tumor extension, tumor limited to kidney. Margin status. Margins uninvolved by invasive carcinoma. Tumor necrosis, not identified. Lymph vascular invasion, not identified. Primary tumor, PT. PT1A, tumor 4 centimeters or less, which is pretty much the lowest that you can get right there. No lymph nodes. Distant metastasis, not applicable. Pathologic findings, no significant pathologic alterations identified. So basically, it's about as good as it gets, I think. Real quick, I want to look up the Furman grade and see what the G2 means real quick. Okay. So grade 1 nuclei are regular with indistinct nucleoli. So basically what a grade 1 would be is like something that is almost identical to regular tissue. G2 is there's slightly irregular contours or have irregular contours and nucleoli present at 40 times. I say, okay, so basically the grade, it's the second grade. There's 4 grades. So this one was the second grade. So in order to see irregularities, they had to microscopically be at 40 times. Grade 3, you can see it at 10 times. So it's easier to see, basically, in other words. And grade 4 is like it's just a mess. I can live with that. Doctor said that cancer-free survival rates are generally about 98%. He told me about my one kidney. He said kidney function for somebody in my age, what's generally going to happen over the next 5 years is my kidney is going to grow. He said that my remaining kidney will grow and take up a lot of what the other kidney was doing, and that my kidney function already right after surgery was pretty much normal. And he said that he will obviously, that'll be something that we look at. There are a couple of risk factors. I'm at a higher risk of diabetes. I'm at a higher risk of high blood pressure. Having one kidney, however, with good diet and exercise, generally those things can be kind of put aside. So I definitely expect to live a healthier lifestyle. You know, anybody who's been following me recently knows that I've already been doing that. I've been running, did a 5K right before the surgery. You know, definitely going to go back to running when I feel able to. But, you know, everything is about as good as it gets when it comes to cancer. We caught it early. We got it out. It's gone. And it's never coming back. That's the way I look at it. So today is a very good day. So those of you who are following me, definitely thank you. Thanks for the few kind words that I've gotten over the last few weeks. Definitely not going to be the end of this blog. I think that, you know, I have an ultrasound in 4 months. I'm certainly going to get screened now for a lot of different things. I'm probably going to, you know, have to see different things. I still have the gallbladder issue going on that I need to see a specialist about. But for the most part with this cancer, we can kind of close the book on it for a while, and we can move on with our lives, and we can look forward to the next chapter. Me and my wife are very happy. So thanks for following along, and any questions regarding the pathology report or anything that I can answer. I've read enough in the last couple of months to pretty much go to medical school and probably be a doctor too. So ask me if you got any questions. But other than that, we'll sign off for this time, and thanks again for watching.